This video is not to scare anyone, but thinking about COVID time, the early days of COVID were something close to this outbreak. Let's talk about Hmpv, virus Human Metapneumovirus. Hmpv is a well-recognized respiratory virus that contributes to seasonal respiratory infections. While it can lead to severe illness in vulnerable populations, it is generally less threatening than viruses like COVID-19. Maintaining good hygiene practices and monitoring symptoms are key to managing its spread. Human Metapneumovirus, Hmpv, is a common respiratory virus that typically causes mild, cold-like symptoms such as cough, fever, nasal congestion, and shortness of breath. It was first identified in 2001, though studies suggest it has been circulating in human populations since the 1970s. Hmpv primarily spreads through close contact with infected individuals or contaminated surfaces. Infections are most prevalent during late winter and early spring, aligning with the patterns of other respiratory viruses like influenza and respiratory syncytial virus, RSV. Here are 5 key ways human metapneumovirus, Hmpv, spreads. 1. Close contact, direct physical contact with an infected person, such as hugging, kissing, or shaking hands. 2. Respiratory droplets, breathing in droplets released when an infected person coughs, sneezes, or talks. 3. Contaminated surfaces, touching surfaces or objects contaminated with the virus, and then touching the face, especially the mouth, nose, or eyes. 4. Shared items, using shared items like utensils, cups, or towels that have been in contact with an infected person. 5. Crowded environments, prolonged exposure in crowded places, especially during the virus's peak seasons in late winter and early spring. To minimize spread, practice good hygiene, wear masks in high-risk areas, and avoid close contact with symptomatic individuals. While Hmpv generally leads to mild illness, it can cause more severe respiratory issues in young children, older adults, and individuals with weakened immune systems. Currently, there is no specific antiviral treatment or vaccine for Hmpv. Management focuses on relieving symptoms. Recent data indicates a notable increase in Hmpv cases in China. During the week of December 16th to 22nd, 2024, Hmpv accounted for 6.2% of positive respiratory illness tests and 5.4% of respiratory-related hospitalizations in the country. Other countries, including Malaysia, India, Kazakhstan, and Italy, have also reported Hmpv cases. For instance, Malaysia recorded 327 cases in 2024, representing 45% of respiratory samples tested. Human metapneumovirus, Hmpv, primarily affects certain groups of people, especially those with increased vulnerability to respiratory infections. These groups include 1. Young children. Infants and toddlers, especially under 5 years of age, are at high risk of infection. Hmpv is a common cause of bronchiolitis and pneumonia in this age group. 2. Older adults. People over 65 years old are more likely to experience severe symptoms, particularly those with underlying health conditions. 3. Immunocompromised individuals. Patients with weakened immune systems due to conditions like HIV, AIDS, cancer, or organ transplants are more susceptible to severe Hmpv infections. 4. People with chronic health conditions. Individuals with underlying respiratory conditions like asthma, chronic obstructive pulmonary disease, COPD, or heart disease may experience more severe symptoms. 5. Residents of long-term care facilities. Nursing home residents and others in communal living environments face higher exposure risks and complications due to close contact with others. As of now, There are no plans to implement lockdowns due to human metapneumovirus, HMPV. Health authorities, including the World Health Organization, WHO, have stated that the current increase in HMPV cases aligns with typical seasonal patterns and does not pose a significant global health threat. Educational institutions and examination bodies continue to monitor the situation closely. At this time, there have been no announcements regarding changes to examination schedules or formats due to HMPV. Students preparing for international exams should continue their studies as planned, staying informed through official channels for any updates. Unlike COVID-19, HMPV is a well-known virus that generally causes mild respiratory symptoms in healthy individuals. While it can lead to more severe illness in vulnerable populations, such as young children, older adults, and those with weakened immune systems, the situation does not warrant the stringent measures seen during the COVID-19 pandemic. Health experts recommend standard precautions to prevent the spread of HMPV, including regular hand washing, avoiding close contact with sick individuals, and maintaining good respiratory hygiene. At this time, no extraordinary public health interventions, such as lockdowns, are anticipated. Here are some precautions to prevent the spread of human metapneumovirus, HMPV. Wash hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, or touching surfaces in public areas. Avoid close contact with individuals who show symptoms of respiratory illness, such as coughing or sneezing. Practice good respiratory hygiene by covering your mouth and nose with a tissue or your elbow when coughing or sneezing. Dispose of used tissues properly. Clean and disinfect surfaces regularly, especially frequently touched objects like doorknobs, phones, and keyboards. Stay home if you feel unwell, particularly if you have respiratory symptoms, to avoid spreading the virus to others. Maintain good ventilation in indoor spaces by keeping windows open or using air purifiers to reduce airborne virus particles. Boost your immune system through a healthy diet, regular exercise, and adequate sleep. Wear a mask in crowded places if the infection is spreading in your area, especially if you are at higher risk of severe illness. These measures not only help prevent HMPV, but also protect against other respiratory infections. Stay safe, stay healthy, stay informed.